Hello, and welcome to another episode of the Hack My Age podcast. Today is just me, a solo episode today. I am going to talk about all the different delivery methods of HRT and what it means. And I've got some samples and I'm going to show you what they look like and try to understand what is out there. Because I remember when I first started looking into hormone therapy, I didn't understand gels, creams, sprays, like what in the world is out there. So I want to try to clear some of that confusion for you. I'm also trying to keep in mind that we have people outside of the US who have their own formulations as well and delivery methods and brands. So I'm going to walk you through some of the brand names, things that we find in both Europe and US and UK, and just how to figure out which one is the right one for you. But before we get into the how, we're going to address the why. Why are so many women still scared of hormone therapy? Well, we can thank one major study from 2002 that changed menopause care literally overnight, and that's called the Women's Health Initiative, or the WHI. So if you listen to any other menopause podcast, you can hear the same story and over again, or you've heard the WHI. But just in case, let me pull back for you because I don't want to just assume that you've listened to a lot of other podcast episodes already. So in short, I won't take a deep dive. There are amazing episodes that do take deep dives into the WHI study, and also a great book called Estrogen Matters. And I'll try to put that in the show notes as well, by Avram Blooming. And you can read that book and see why this WHI study went so wrong. And so this was one of the largest studies ever done on post-menopausal women, not peri, not pre, post-menopausal women. It was massive, and it's probably never going to be repeated again because it was so big and it costs, I think, over $700 million, more or less. So we can't expect another massive study like that. But it had about 160,000, over 160,000 post-menopausal women in the US, and they gathered them from, I think it was somewhere between 1993 and 1998. And the goal was to see if hormone replacement therapy, or HRT, could prevent chronic diseases like heart disease, osteoporosis, and cancer. Like, that was what they were looking at. They weren't looking at, can they suppress a hot flash or things like that. So they used, most of the women at the time were using Premarin, which is conjugated equine estrogen. This is a type of estrogen that women were using. It started evidently in 1942. And then I guess about 40 years later, they said, oh, okay, this is one of the most prescribed, I think it is the most prescribed drug in the United States. So there were two main arms. There were women on estrogen only hormones, and then women on estrogen plus progestin. And I'll explain what those mean a little bit later. But about halfway through, the researchers stopped part of the trial early because they said that there were women who were on the combination of estrogen and progestin. They were having a higher risk of breast cancer, heart attacks, and strokes. And so they literally just stopped, and the headlines made the press even before the researchers really made their final conclusions. And all we saw was hormone therapy causes cancer. And that went like wildfire because we love sensational headlines, right? And literally overnight, millions of women stopped their hormones, like dumped them in the toilet, calling their doctor, freaking out. And if you listen to any of the other doctors that I've interviewed who went through this transition, who were prescribing women their hormones for years, and then suddenly this came out, you can hear the struggles that they had. But most doctors read those headlines. They didn't actually read the study. They just said, okay, let's stop prescribing them entirely. And I guess that some of the doctors as well were thinking that it's kind of hard maybe to get a woman on hormones, in the sense of finding the right dosage for her and everything. Boy, let's just leave this on the table. We can go back to prescribing birth control and antidepressants. It's so much easier. So there was the problem. The women in the WHI study weren't the ones who were actually likely to benefit most from HRT, because the average age was 63, and many of them were 10 years past menopause. And all of them, and a lot of them already had signs of heart disease. They were unhealthy. They were obese. They had high blood pressure. They had earlier cardiovascular disease to begin with. And they actually didn't take the women who really needed to have this, who were having the classic menopausal symptoms that we're all thinking of, because it was designed to be a disease prevention trial, not as a study to treat menopausal women with their hot flashes and night sweats. So actually, many of the women in the study didn't have any menopause symptoms at all, or not significant ones. So this is why it's so hard to apply the results from this study to a younger, healthier menopausal population. So you can think about it when you're in your 60s already, some damage has been done. Some plaque's been building up in the arteries. You've been closer to diabetes if you've been pre-diabetic. There's a lot of issues. So we really got to put things into context here. And then on top of it, the hormones that were used in the study back then are really different than what doctors are prescribing today. So the main estrogen that was used was called the conjugated equine estrogen. You probably heard about this, CEE. If you read any research papers, they're still researching this. Well, gosh, I don't know why, but okay, they still do. It's still prescribed. And this comes from a pregnant horse's urine. And a lot of people are like, ew, oh, that's gross. And I personally, like, I don't know, I eat animals. I can't really say that. Not that I drink their urine, but it's a bit hypocritical for me to say, oh, that's gross when I eat shrimp or eat a chicken. So I don't know. I'm okay with animals. They're natural, right? So it's not that's such a problem. It's just what it does is a problem. And then for the progesterone part, which they called progesterone, is actually not progesterone. They were using a synthetic type of progesterone called a progestin, and it was medroxyprogesterone acetate. And because it has the word progesterone in it, medroxyprogesterone acetate, like you think, oh, it's progesterone. No, it's not. And then again, when you also try to look at research and look at studies, these words get thrown around all the time. It's so hard to tease out. Is this a quote unquote natural progesterone? Is this a synthetic? And we're going to talk about the differences in a little bit later. But the actual cancer risk, what came out of this? And they found out that about 8 extra cases per 10,000 women per year were having some elevated, minor elevated breast cancer risk. And it's small, but it can sound scary when you're not presented it with the context in mind. And then later on, they've had follow-up studies and they showed that estrogen alone, remember there was the estrogen arm and then alone, and then there was the estrogen plus progestin arm. But if you took estrogen alone, it actually had a lower risk of breast cancer. With all the problems of the WHI that we're all complaining about, we still showed this. And that didn't make headlines, unfortunately. And then they also found out that when HRT was started within 10 years of menopause, the benefits for the heart and even overall mortality was just so much stronger. That didn't make headlines either. So it's not so much the problem, the data. I think it's the problem, the way it was interpreted. And again, who was in the study. And the fear that has been made is just lingering on for decades and decades, 20 years to more or less. And even now, I mean, I still meet plenty of women who are afraid of hormones when in fact their whole body has been thriving on it most of their life. But the good news is that for women who are in early menopause, the modern HRT that we're using, especially bioidentical hormones, which we'll talk a little about in a minute too, given in the right dose and the right form, is safe. And all the major menopause societies around the world are agreeing with this. So you can put that fear of hormones to rest. But I want to talk a little bit because I want to show you different formulas and different things that are used around the world. I want to clear the confusion that people have between like FDA approved or pharmaceutical versus compounded, personalized. Some people use that word. And I also want to clear the confusion between bioidentical versus synthetic. So yeah, let's first speak the same language here. So FDA approved HRT, or in Europe, we have the European Medicines Agency, the EMA, it's the equivalent of the FDA. These are medications or hormones that are tested for safety, quality, and efficacy. They're effective, they work, they're safe. We know exactly how much the dosage is in there. They're highly regulated. So US brands of hormones, let's say, would be called the estrase. Estrase is one brand. It's an oral estradiol. It's bioidentical. We don't really want to go down the oral estradiol or oral estrogen route for the same reasons. The conjugated equine estrogen, it increases the risk of blood clotting and then, of course, a heart attack or a stroke. So we don't want that. But okay, it exists and it is bioidentical. So I don't want people to think FDA good, compounded bad, or bioidentical good and synthetic bad. It doesn't really work that way. And even with the synthetic ones, there's some women who thrive better, who do better on that. And if we start to put labels on good and bad, then they're going to have this fear as they're taking something that's probably really, really beneficial for them and the benefits outweighing the risk. And other US brands for FDA approved are Vivel Dot. It's a patch, the Climera patch, Prometrium, which is micronized, progesterone, estrogel. Okay. The European brands of, let's say, EMA, European Medicines Agency approved, is Estrofem, Estradot, Evorel, Utrogestin. Actually, Utrogestin is now called CD-Gestin. They've changed the name for some reason. So those are the European brands. And I'll show you a little bit later when we're talking about delivery methods. Okay. That's the FDA approved or the EMA approved stuff. Then we have compounded hormone therapy. And this means that you're getting a quote unquote special formula just for you or made for you. And pharmacy's compounding them. Your formula is being tailor-made in a lab for you because you need a certain dosage that doesn't exist in the pharmacy already pre-made, or you're allergic to peanut oil that's in some of the products out there. You don't do as well with what's out there in the pharmacy. So you need a special dosage. And they do this not only for hormones, but all kinds of medications. And thank goodness we have that, because what would we do without it, right? So I hate to say that a lot of people poo-poo compounding pharmacies. They say they're not regulated, they're dangerous. I've even heard some menopause doctor refer to them as buying gasoline off of the corner from Joe Schmo. It's not like that at all. I've interviewed Carol Peterson, who's a compounding pharmacist, and she actually would argue that compounding pharmacies are even more tightly regulated than FDA. That's debatable, but it is regulated, right? The final product isn't regulated, but the actual ingredients are FDA approved. Like, they do check that they're really putting in the progesterone or the estradiol or whatever. And there is quality control. It depends on the pharmacy. And I would say, if you trust your doctor, and if your doctor's been treating women through menopause for a long time, then he or she is probably seeing some effects, and they're probably working. And you will know, because if you get a compounded estrogen cream for you and you don't feel anything, well, then it's not high enough, or it's not, the delivery method's good. It has nothing to do with, oh, it's a bad thing to get compounded hormones. No, you'll know if they work or they don't work. So then that's the FDA approved, you have the compounded HRT, and now you can also find hormones that are over the counter. Like, you can go online, you can go into internet and Google this stuff and buy it online. So they're not the same as what you get in terms of a prescription, whether it's your doctor needs to prescribe you hormones, right? But you can also buy this online. So over-the-counter hormone creams and supplements, they have usually some herbal extracts, and most commonly would be wild yams in your progesterone cream, or some phytoestrogens. And it's not actual estradiol or really the progesterone at therapeutic dosages. Doesn't mean that it's bad. You may just need more, or maybe sometimes it's a good thing and you don't need it to be as strong. So what's a little deceiving is that these online places that you can buy these products are using the words natural. So you feel like it's better, it's safer. And it's not the case, right? That's really not the case. You don't know. They may not deliver enough of the active hormone there to relieve your menopause symptoms or even protect your heart and your bones. And it's really the regulation. It depends, again, on the brand and the things that you're getting. It's either weak or non-existent. So very much unlike an FDA approved or EMA approved, these hormones that you're buying online, they don't need to prove purity and safety and efficacy before they go onto the market. There are ways that they get around these regulations because they call it a beauty product, because they're not intended for menopause relief, although they can work, right? If you're feeling bad, I mean, you can try it, but we have to understand it's a little bit like a supplement. You have to have real faith and know, or I would dig deep into a company to understand what they have in there, it really is inside there. And you can call the company, you can look at if they have any third-party testing, you can see if they're USP approved and things like that. I would still be very cautious about things that you buy online. You don't even know if the dosage is correct. It can vary from product to product. And again, if you believe the product is safe and you're not feeling it, well, then maybe you just need a little bit stronger dose, or maybe you need to put it on a different part of the body. You can give these things a shot, but again, with caution. Just be a little bit careful with things that are really saying that they're natural, or even if it says bioidentical. We have to just have do our due diligence. So you may see things like anti-aging miracle or risk-free HRT or all natural cure. These are very misleading words, okay? Just because something is natural or says it's risk-free doesn't mean it actually is. But I know you guys are smarter. I know you. I feel like I don't need to say this, but anyways, I'm saying it. The other thing that you may not know, if it on the labels of some of these over-the-counter products, they will say USP, United States Pharmacopoeia, and that's an independent scientific nonprofit organization that sets quality standards for medicine and supplements and some ingredients that are used in compounding products. And so if a hormone like estradiol or progesterone is labeled USP grade, it just means that it meets those standards for purity and strength. So that's already something that's pretty good, but it's not the same as testing the final cream for the FDA does or EMA does, EMA or FDA approved. It's a good sign, probably using some better than, I don't know, some unknown quality ingredients. But again, it's not the same as using a regulated approved medication. Buy these things with a lot of caution. As much as I'm warning you, I'm a big fan of Karen Martell's Hormones. This is a friend of mine. She has a great podcast. Here's her hormones. If you're on YouTube right now, you see I have her estrogen and progesterone and all that. I know her. I trust her. They are USP grade. She's been using them in her clinic for a long time now. And again, I have to take that risk. But I really, really trust her. So I am one of those who buys these things online. But I have a lot of other things too. And I'm always testing, measuring, and assessing. Do these hormones work? So let's now move into, we've done the FDA approved, we've done bioidentical, we've done the compounding, and we've done the sort of online over-the-counter stuff. Now I want to clear up the confusion on bioidentical hormones, okay? This means that the structure of the hormone, like if you look at it under a microscope, they are identical to the ones that your body makes, like estradiol, okay? And we're gonna talk about the differences between estradiol, estrone, and estriol later on, just hang on. Progesterone and testosterone can be bioidentical, right? So we're going to talk about bioidentical versus synthetic. So bioidentical, it can be in an FDA approved product, the stuff that you find in the pharmacy that doctors prescribed, or it can be in a compounded form that is made in a laboratory. And it can also be found online, over the counter stuff. And they come in patches and sprays and gels and all these kinds of things. Generally, in my world, and the people I've interviewed, the doctors I've interviewed, most of them are using like 99% of the time, the bioidentical hormones. They said there's enough evidence for them and they feel better giving this to their patients. So again, doesn't mean synthetic's bad, but I'm going to explain to you what synthetic means. Synthetic is not identical to the structure in your body. So an example would be the conjugated equine estrogen. Now remember, the WHI study showed that there was a lower risk of breast cancer with just the estrogen only. So it was the progesterone that was at fault there. So some women I've met have to take some synthetic because they're not reacting to the bioidentical. They feel nothing. So I don't want to, again, say poo-poo synthetic. It's just when we have an option, it's always generally better to go with the bioidentical, something that our body recognizes immediately. Because also, I remember when I interviewed Dr. Felice Gersh, I'll never forget it. She said, when you get the conjugated equine estrogen, the Premarin, you're not only getting the hormones, the types of estrogens that are helping you with your body, but you're getting a whole list of other estrogens that horse is making that you don't need. Like, why would you even want that? Again, it's there. Try not to use it unless you really need it. And then another example of a synthetic hormone would be the medroxyprogesterone acetate, or Provera. Okay, so that's the brand name in the US. So these are well studied, like that. I'm still doing research on this stuff, but they have different side effects compared to bioidentical hormones. And I'll explain a little bit the differences later on. So now we're going to talk about the different types of estrogen. I'll go through this very quickly. There's E1, E2, and E3. I mean, there's others, but we're just going to focus on those right now. So when we're talking about estrogen, when you read a study that says estrogen or somebody says estrogen, they're talking about a family of hormones. It's like saying fasting. Well, I don't know. There's intermittent fasting and there's 24-hour fasting and then there's the 5-2. Like it's just an umbrella term. Okay. And so when we're talking about menopause and our hormones, we're usually talking about E1, which is called estrone. And I remember that because it's estrone has the word one in it, O-N-E. And then you have estradiol, which is E2. And I remember estradi, di meaning two. So you remember that. And then estriol is E3. Okay. And then in research papers too, you'll see some E1, E2, E3. Sometimes they differentiate these things, sometimes not at all. They just say estrogen. You're like, well, which one? What are you talking about? And I remember estriol is E3 because you have the word tri. Okay. So knowing the differences among them really help make sense of why some products are prescribed and some aren't. So let's go through E1, estrone. It's produced mainly after menopause in the fat tissue. It's a weaker estrogen compared to estradiol. And usually estrone rises when estradiol falls naturally, but it's not usually prescribed in HRT. I don't know anyone who's taking estrone. There was a time when hormones were formulated. They said, well, why don't a woman has all three? So let's put all three. And it was called Triest. Since then, they realized they don't need the estrone. And it's actually a little bit more inflammatory and we don't need more inflammation, right? So estradiol is E2. It's the most potent, it's the most active estrogen that we have, especially during our reproductive years, pre-menopause, where our estradiol is up and down and it's high and we're full of it. It regulates our menstrual cycles. It helps with bone health, heart health, our brain, and vagina, everything. Like there's so many receptors in our cells and our tissues and our body. We need it. And the form that's used most often in HRT is estradiol, and it's bioidentical. It's identical to what our body makes. And then we have estriol, E3. It's the weakest of the three estrogens, and it's produced a lot in pregnancy and in menopause, very often in menopause treatments. They usually use it in local vaginal products. It's gentle, it's effective, and it helps with the genitourinary syndrome of menopause, meaning UTIs and dryness, vaginal dryness and itchiness and all these things. So it's quite useful. You get a lot of women using that. And sometimes you'll hear a product called Biest, meaning, bi meaning two, and then est meaning there's two estrogens, and it's usually estradiol and estriol. Now let's talk about the delivery methods, and I can bring up my samples here. So if you're not on YouTube, I'll try to describe this, but go to YouTube if you're not there already, and you can see that. I think YouTube is so great because it helps you visualize these things. So first you have an oral tablets. Let's talk about oral hormones. We have oral estrogen, we have oral progesterone. I think there's also oral testosterone, like a sublingual, but we're not going to talk about that today. So the oral delivery method, some of the brands, I don't have any oral estradiol at home, but I'll put a little photo, an image here, what it looks like. But some of the brands in the US are called Estrace. It's an estradiol. There's, of course, the Premarin, that conjugated equine estrogen. Then there's Prometrium, which is micronized progesterone. That's bioidentical. And then there's Provera, the synthetic progesterone, and those are all taking orally. In Europe, we have estradiol called Estrofem. You have Progenova, and then you have Cedigestan. Oh, here, I've got a Cedigestan here. It looks like this. You have a little box, and then they're really great. They're actually these teeny tiny balls and easy to pop in your mouth. And that's what you get in Europe very often. I think most people I know in Europe who are on oral micronized estrogen, I take 100 milligrams, are on that. And so the great thing about oral hormones is that pop them in your mouth. A lot of people like to just take something and it's in you, and you don't have to worry about transference of a cream going onto your dog or your grandkid or your husband or partner. That's the easy way. And it's familiar, I guess. And then you have the cons. So oral estrogen, it goes through the liver, and this can increase your clot risk in some women. And then you have the progestin. If you're using the synthetic oral progesterone, then you have the increased breast cancer risk. So those are pretty big ones. That's why most people try to stay away from either synthetic or even oral estrogens. Then we have the patches, the transdermal patches, meaning something that you're putting on the skin. Derma meaning skin, and something transferring from the skin into your bloodstream. And I don't use patches. I don't have one to show you, but you can always go on YouTube, or you can look at this little image here and you see that there's US brands are called Vivel Dot, there's Climara, there's Minival. European brands also use something called Estradot. And then there's another one called Everel, which is just the estradiol. But if you're using a patch called Everel Conti or Everel Sequi, it's a blend of a bioidentical estradiol, yay, and a synthetic progestin. So you maybe not really want to use those unless you really absolutely have to. And then they have another one called Climara and Fem7, which is the same thing where it's using an estradiol, and then you have a progestin, not actual progesterone. But the benefits about taking a patch is that it bypasses the liver, so you don't have that risk of clotting and a stroke and a heart attack, and it has a steady hormone release, steady. Yes, for some people, and yes, for no people. I've heard that as the days go by, because you can change it once a week or twice a week, they're little sticky things and you stick it on your skin, and some people actually love it. It's teeny tiny, and or there's some that are, I've seen them that are bigger. Some women, and you put it on your abdomen or you put them on your behind, like your bum, and you can put them in usually those are the two big places, or even on the upper thigh. But so they can be great. I think it's great that we have these options. I don't use them, and I'll tell you why in a moment, but I think that can be great. But for some women, it irritates their skin. The glue that's on there can be, usually you see most women around us, they have this little, the felt can, it's not a big deal. You just scrub it off when you go into the shower. But some women have discolored skin or irritation. They don't really like that. So there's some pros and there's some cons, but they do like the fact that, oh, I don't have to do this every day. I only need to do it once a week or a couple times a week. Then we have gels, sprays, and creams. And I have some of these myself, and I can show you. The US brands is Estrogel. I think it's probably the most well-known. Divigel, Elestrin, even Mist Spray. These are things that you easily find in the US. And the European brands, we have Estrogel, or we have Estroclean, Clin, and you also have Divigel, and you also have a Lenzetto spray, which I have here too. It looks like this little plastic, I don't even know, it looks like an inhaler, but you take off the cap and you see the product comes out of the little entrance there. You put it on your inner forearm and then you press. And I loved it when I used it. In fact, I liked this spray the best because it would dry instantaneously. And you can put on your clothes, you don't have to wait. It was really absorbing quickly. But when I went to go test, my levels were still very low, as if I weren't taking anything. And I tried increasing the dosage, and it just, for some reason, my body didn't want to take it. But I thought it was great. And the reason I have the estrogen here, the Estrogel, Estroclean, is I started using this, but I don't like it because you have to take this, if you see this little syringe type thing, you open this up and you could see the gel coming out, and then I have to suck it up, and I'd always get air bubbles in here. And then of course I had to get a ton out, and I had to wait forever for it to dry. And then after my podcast interview with Dr. David Rosensweet, who prescribes organic oils, which is the best. I think if I had a choice, we don't have this choice in Europe, but you can get it in the US, where it's an oil and you literally put on a teeny tiny drop. And he created this formula because we had this discussion about when you're putting all these creams and gels on your body, I think he said about 98% is not actually hormones. I think it was something like 2% or 5% was hormones. Very, very little of what you're putting on your body. And I was slathering myself in this gel. It's just chemicals. And here I am thinking, oh, I'm trying to do non-toxic hairspray and non-toxic like soap and shampoo. And here I am throwing all this gel on my body without really questioning what is the base. What is that? And it's usually not really good. And it can add up to gallons every year. So that's why I got frustrated with the gel, the Estrogel, and I decided to go with a compounded formula of cream. And I like the cream. And you see here, I have a click system, and you see just a little tiny bit comes out. Like literally, that's all I need. It's smaller than like the head of an eraser. It's so tiny. I have to test actually to see if this one works, but because this is a new formula, but it is so far so good for me. And I love the fact that I have a precise dose each time. You can get a precise dose too if you had like a pump. Here's Karen Martell's estrogen, let's say here, and you can see on the video that you have about, I don't know, one pump. Actually, one pump is that much, a lot more than what I have with my compounded. But I use this on my face. I use it on when I feel that I need a little extra bump. Then I use her brand. I love it. So that's with the gel stuff. So the great thing about gels, I remember now it is, I think I may need a little more estrogen for my brain. The great thing about gels and creams is that I can adjust the dosage. If I want to do like half a pump, I can do half a pump. If I want to double my dose, I can do 2 pumps or 2 clicks. It's really, really great to do that. I love having that control. And I like to play around with my hormones, and I like to listen to my body. And one of these, maybe it's wrong. I don't know. But some people like static dose every single day. I don't need anything else. But for me, there's sometimes I feel like, oh, I'm a little hot at night. So I'll have this Karen's estrogen cream right at the side of my bed, and I'll just do it right away. I'll put it in right away. So that's what I really like about those things. One of the negatives is, again, if you are have to put a ton of it on, then it gets frustrating. You have to wait for it to dry. And you don't want to touch dogs and babies and partners because you could transfer your hormones to them. Maybe not such a big deal if it's testosterone with a male partner, but if it's estrogen, you don't really want him getting that in your pets and babies as well. So you just need to wait about 30 minutes. I've heard some doctors say 1 hour. Dr. Rosensweet, who I went through his program, the Institute of Bioidentical Medicine, and he taught us that it's usually just about half an hour. Not a big deal. You wait for it to dry, and then you can touch whatever you want to touch again. So then we have vaginal estrogen. And vaginal estrogen is for these local symptoms, UTIs, painful sex, dry vagina. These kind of issues are a big deal, and they work really well. You can solve them really well with a local vaginal estrogen. And in the US, you have something called Vagifem. There's Estring, which is a ring, Estrace cream. You have some soft gel. These are all bioidentical. Okay, you're putting something up your vagina, probably want it to be safe and effective. And you have the FDA approved, you can get compounded, whatever it is that you need, depending on your needs. And in Europe, we have things called Vagifem, Ovestinone, or Efestin. So there's a cream called Evestin, Estring, Ganaflor. These are also all bioidentical estrogens. And so there very often actually is estriol. Estriol is very often used for your vaginal cream because it's much weaker and it stays local. Like it should not go systemically, meaning other parts of your body. But there are some people who say, yeah, no, I've tested and actually it did increase, but it's usually very, very minimal, if at all. And so here's a brand called Avestinon that I was using. I don't use it anymore, but they are vaginal suppositories, or they're called. There's also, this one is a vaginal. So it looks like this. It's got this it looks like a little bullet that you put in at night because, of course, it's very waxy and you don't want to put it in the day because then it kind of melts and then your underwear is like not nice. So you're laying down at night, you put it in, and it's quite easy. And I started using it when my doctor told me I had vaginal atrophy. I was like, what's that? And that's when the inner lining of the vaginal area is getting thin. And she said, do you have dryness there, or is it painful sex? And the answer was no. But I wanted to reverse this, whatever it was. So then I took the Ovestinon, and it's just estriol. It's how many? The 0.5 milligrams. And I tested again after a year and it was gone. She's like, oh. And I was like, oh, you mean I reversed it? So yes, you can. But now I've tested again. It doesn't seem like I need it. So I let it go. The thing with the vaginal estrogen is great for those genitourinary symptoms, but it really doesn't help with hot flashes and bone loss. So you'll probably need estradiol for that, right? So you've been using estriol for the vaginal local stuff, and then you have estradiol, usually as a cream or a gel or a spray. Now, what about progesterone? We have different brands of progesterone. In the US, you have Prometrium, which is the oral micronized progesterone, which would be the equivalent of the Sedegestan in Europe. Right? You take these little oral tablets at night, or you have gel, crenone gel. In Europe, we have something called Cyclogest, which is a vaginal or rectal suppository of progesterone. It's bioidentical, it's EMA approved. And they also have crenone gel here too. And you also have, I probably out of Karen Martell's products, I use progesterone the most. Her Progest Calm. It's 50 milligrams of progesterone. And again, I like the fact that I can do half a pump, I can do a full pump, and it's there. Actually, I'm just going to put it on my arm. I might as well use this. So the thing that's great about these gel options is that you can adjust the dosage as you need. But when you're taking it, usually it's orally, it protects the uterine lining when you are taking estrogen, because estrogen is proliferative. I mean, some women also have great results with just the transdermal. They don't need the oral. That's why we test, measure, and assess. Just go and look at the uterine lining. Is your gel or is your cream or is your progesterone, oral progesterone working? Do you need to increase the dose or decrease it? Is it getting too thin? Is it getting too thick? But we love to have progesterone, especially if you have your uterus still intact, to make sure that you're not creating a breeding ground for cancer. We need to have it not too thick, right? So that's the benefits of taking progesterone. And even if you don't have uterus anymore, if you had a hysterectomy, I still recommend progesterone, or at least recommend to look into it, because there's so many other benefits that we get from progesterone. We have a whole other episode on that if you want to go listen to it. Some of the cons of the oral progesterone is that it can make you drowsy. Some women really don't like progesterone at all. They feel they can't wake up in the morning. They are feeling more anxious when it should be making you feel calm. And again, this very often times, this is just a matter of balance, trying to figure out what is your balance. It's not like you have too much or too little. It's too much or too little in relation to the other hormones. But generally, progesterone, if you do like its sedative effects, because it makes you sleepy, you can usually take it at night and it's going to help you sleep. And then we have testosterone. We don't have any FDA approved female specific testosterone in the US, so you need compounded. And the same thing for Europe. Although in the UK, I think you can get Androfem, which is, I think it's made in Australia, and I think that's a 1% testosterone cream. And that's awesome, because if you like the FDA approved stuff, great. But most of us need to go either off label with something called Testim or Testogel. These are male formulations, and you're supposed to take 1/10 of the dosage. And when it's a cream that's in a little packet, you're like, how much is 1/10? I don't even know. Let's just dab it and see and play around with it. It's not ideal. I hate trying to guess. I like using exact dosages, or at least knowing what's in a full pump or in a full click. That's my thing. So that's why I get mine compounded. And this one is just a pump. And again, I can regulate that if I want a full pump, half a pump. I love it. It can help. Testosterone, again, depends on why you need it. There's so many reasons. It could be for low libido, which is often why it's prescribed, but not everything is hormonal, right? So if you're taking your testosterone and you're like, I don't know, it's not helping, it's probably not hormonal. It could be something else. More women may feel more energy. They may feel more motivated to go to the gym. They feel maybe a little easier to build muscle. Again, not everyone, we all have different experiences. But again, the difficulty with testosterone is if you cannot get it compounded, you got to use it off label, and you just need to monitor yourself really carefully. We don't want to overdose testosterone, and we want to make sure it's converting it or not converting right into estrogen, because sometimes that can be a problem. You may go, well, I don't know, I have this sort of estrogen dominance, I have this weight gain, but it could be coming from your testosterone. That's why you need to be working with someone who knows what they're talking about here. Now, there's two more things. We're going to talk about pellets, and we're talking about injectables, and in terms of hormones. So pellets, I always say do this with very caution. In the US, you have all these these clinics that are popping up, and they do things with BioT, Sotopel, Avexapel. They embed a little pellet inside your backside, and it sits there usually like for 3 months. And they're usually compounded in Europe, and you have to go to usually a private clinic, and they're quite expensive. There's no brand names here. The reason why some women love it is because they just get this big boost of testosterone and a massive improvement in their libido, and they just feel great. But after it starts to deplete, because in the very beginning you get a large dosage and then it slowly goes away, you're kind of stuck for 3 months, and you feel towards the end it's just wearing off, and you have to wait, I guess, till the 3 months are over to put in another one. And so it's just, you don't have much control. There are women I've spoken to who say, oh my God, it was the worst thing I ever did. Like, it was way too much, but they couldn't do anything. So if you're going to explore the world of pellets, like, find your dosage first with creams and gels or oral or whatever it is that you can, because it's not just testosterone. You can get estrogen in pellets as well. So find out what your dosage is before you even go down that route. Again, it's kind of, for me, I get it, the fact that women love it. You can forget about it for 3 months, but again, you're kind of stuck with it. But that being said, there is a very interesting podcast that I listened to with Karen Martell, and she was interviewing, oh gosh, I don't remember who it was, but it was called The Other Side of Testosterone. And it showed some of the benefits of using high dose testosterone for cancer. And it was kind of crazy. So I guess if you there are some people maybe who have a lot of experience and can do this. I'll put the link to that episode in the show notes. Go listen to it. I don't like to poo-poo anything. There's always someone who needs it. So it's just not the first thing I would do is go to pellets. And they're very expensive. So the other thing is injectable. Let's talk about injectable hormones. There are the US brands out there, let me see, is because I'm not so familiar with the US brands, especially when it comes to injectable. I don't have a lot of experience with this. There's estradiol valerate injections, there's testosterone cypionate injections. And in Europe, we have estradiol valerate and testosterone and enanthate. And again, these are just, we don't really need to remember these words. It's just, they're more interesting when we're talking about some of the FDA approved or EMA approved stuff that most women are seeing, because most women are not really going, who wants to inject themselves, honestly? The only reason we do these things is because we can't absorb them in gels, creams, patches. It's oral, it's not working. So then the last resort is usually injectables. And again, it's saved so many women. So wonderful that we have this choice. Some women say that there's some peaks and crashes depending in between their injections, because I think you do them like once a week, a couple of times a week. It depends on the dosage, and everyone is different. So you got to figure that one out. But injectable is an option, and that's wonderful. We have it. So let's go. Oh, the other thing that when you talk about injectables, you'll see that some people are saying they're intramuscular or they're subcutaneous. And you're like, what does that even mean? So if you're intramuscular, okay, that means you need to go deep into the muscle, like the glute or a thigh. And the needle is usually between 1 and 1.5 inches. It's kind of long. So it's got to reach the muscle. I don't have any. I should probably, maybe I'll see if I can get some images to post here on the video in YouTube. And they're usually, intramuscular is usually faster than subcutaneous because the muscles have a really rich supply of blood in them. And so again, you may love these. Great. It's fast acting and it's can deliver a large volume of whatever it is that you need, whether you're doing estrogen or testosterone, whatever it is that you're injecting yourself with. The con, well, yeah, it's kind of painful. You may get bruising or muscle soreness. It may be hard to inject yourself, especially if you get squeamish about injecting, but usually if you love it and it's working, then you get over it. That's the thing. Again, I met many women who were just saying, yeah, I got used to it. It's so worth it. And then you have subcutaneous, and this just goes just under the skin, and you use it. It's kind of like, imagine you're injecting insulin. You just in your belly or maybe in a thigh. And it's a little slower, more gradual than intramuscular, but it's steady, less painful, easier to self-inject, less complications. And again, it's some women love it, some women don't like it. It's very, very personalized. And you can't do a huge dose. The needle is like half an inch. It's much shorter. But there you go. You got choice. Now, what about cost? Because a lot of women go, well, yeah, I love all these things, especially compounded. It's too expensive. Or they go to some of these personalized online telemedicine clinics, and those people are making a fortune. Thank God we have an option, but not everyone can afford it. So when we're talking about, let me try to go formulation by formulation and give you an idea of how much is this going to cost you. And it depends on, do you have insurance? Does insurance cover it? Which delivery methods do you really need? The ones that are working, right? Because maybe you love the oral stuff and it's less than $10 a month or about $10 a month, but it's not working. So you got to go somewhere else. But if you get a brand or something fancy, it can be like $500 a month. I mean, insane. The US is so crazy. I did a post on how much I asked in my Instagram, my Facebook, how much is your HRT costing you? And you had wildly different numbers here. And again, sometimes the government pays for it, depending on your country. Sometimes it's included in your Social Security. Sometimes it's covered by insurance. And sometimes you just got to pay out of pocket. And I have to say the US seemed to be paying the most for HRT, which is insane. It shouldn't have to be that way. In the US, patches go for anywhere between $40 to $250 a month. Gels and creams, somewhere between $40 and $60. If it's generic, the higher brands, $165 or even more. Vaginal inserts and rings are less than $50 if you're going with a generic. It can be $200 a month if you are going with some kind of another brand. And then the injectables, somewhere between $24 and $120 a year. Pellets can be crazy expensive, around $1,000 to $1,400 a year. It's all over the place. But think about it. Usually you're not just using one, you're using two or maybe three or sometimes four different types of hormones, and that can cost a fortune. Honestly, it's up to you and your budget and what you have or what's available. What does your insurance cover? In Europe, thank goodness, where I am, it's so much cheaper. I mean, I pay, you see the Sedigestone, this is progesterone, oral micronized progesterone, it costs me €5 for, it's like 30 days. And I only do 15 days a month, more or less. So it lasts me 2 months. So $2.50 or €2.50 a month. It's crazy. It's so good. That's why I love this. Is EMA approved. It's like an FDA. It's not compounded. It's nothing special, tailor made to me, but it works just fine. If you are going for the EMA or the prescription or the pharmaceutical HRT, then that's everything else is usually around 20 to 30 euros a month. Okay. And that's usually it's about 30% more in US dollars. So let's say it's like $30 to $40 a month. And then if you have something compounded, okay, this is tailor made, and usually this is so crazy expensive in the US. I pay for my compounded testosterone and my compounded estradiol. They're usually somewhere between 35 and 40 euros for a bottle. And that bottle lasts me 2 to 3 months. So it's very affordable. And then there's some places like Ireland that have free HRT on their medical card eligible pharmacies. So lucky them. And then if you're looking at the UK is also even better than Europe. They have, in England, they have this system called the National Health System, NHS, and it usually costs £9.90 per prescription. And that's, I guess, I don't know, I'm so bad with pounds. I would say maybe $15 for prescription, but you can get something called an HRT prescription prepayment certificate, or PPC. And so if you know you're getting regular hormone therapy, you can get it at £19.80 per year. Again, that's probably about $30 a year. And that covers a lot. So that's pretty awesome. And then in the UK, there are some exemptions. Like if you have a very low income, you have certain medical conditions, you can get totally free NHS prescriptions. So HRT could be free of charge. That'd be great if we all could get that. And so that's it. So let's talk about choosing the right method. Okay. You're going to go to your doctor and you're going to say, hey, I'm interested in hormone therapy. Where should I start? What should I get? Now you know all the different things that are out there, some of the benefits, the drawbacks of just the practicality of things. So you will have to talk about your health history, because you're going to talk about the benefits versus the risks. Are you at risk of clotting? If you took birth control, for example, that's oral estrogen. So if you notice that, yeah, you're not doing well with birth control, then you probably want to make sure you go at Transdermal. Do you have migraines? Do you have any liver issues? Whole history you got to look at. A good doctor will ask you lots of questions before prescribing. And then you have to look at your goals. Like, do you just want to suppress the symptom? You just want to stop waking up at night with hot flashes and night sweats? Well, then that may be one type of hormone or product or dosage. Or do you want to promote longevity? Do you want to protect your bones, your heart, your brain? There's no guarantees with anything, because obviously we have lifestyle medicine and diet that counts a lot. So you need to still work on those things, but you may need different dosages, and make sure that you test, measure, and assess to make sure you're absorbing. It's not what you take, it's what you actually absorb. And then you got to talk to your doctor about the symptoms. That's probably like the most number one thing a doctor will ask you, like, what are you feeling? What do you need help with? And then you should be discussing your lifestyle. Are you bothered by using a gel every day? Like, you can't stand doing that. Or do you prefer just putting a patch on once a week? And you have to see what's available, what's affordable, what's your budget like, what can you get in your country? Every country is different. But the most important is that you just find a doctor who's knowledgeable in menopausal medicine and can help guide you. So that's it, right? I didn't talk too long, but I hope you learned something here. The key takeaways are the WHI study unfortunately scared a generation of women, but it really has nothing to do with the types of hormones that we're using today, especially the bioidentical, and especially if you're starting your hormone therapy early on in your menopause journey or perimenopausal journey. Remember, also delivery method matters. You got to look at the safety, you got to look at symptom relief, you look at convenience. You now know what the difference is between FDA approved bioidentical hormones versus compounded bioidentical, you know what synthetic means, and you just have to get the guidance from your doctor what is best for you. And yeah, just find a doctor. If you need help finding a doctor, in the show notes, I have a link to a guide on how to find a doctor in your area. You don't need to leave me your email, and nothing's going to come and spam you or anything like that. Just go and read it. There's some doctors there that have been, with their names and their websites, that have been recommended by women in our community. I don't know some of them. I know some of them. I don't know many of them, but the women in our community say, I love my doctor. So whenever they say, I love my doctor, I said, can I please put your doctor's name and information on this list? And if you're obviously not in the US, I do have doctors all over the world, in Philippines and France and UK and all that. So most importantly is, if you are getting hormones prescribed to you, you need to get them prescribed in your country. And if you're in the US, in your state, or at least there are doctors who are working online. Telemedicine is fine. You can definitely do all of this with a doctor on a Zoom call. It's just that you got to make sure that doctor is able to prescribe in your state. So again, you'll look at that How to Find a Menopause Doctor blog, and it's going to walk you through all of that. So I hope this episode cleared up some of the confusion for you. If it was helpful, please share it with a friend who's been a little confused as well, or nervous about hormone therapy. And if you have any questions or anything specific that you'd like me to cover in a future episode, send me a message. I'm here to help you. And thank you so much for getting to the end of this podcast, and I will see you next time.